Welcome to Alberta Impact, Future of Health series. I'm your host, Bryce Lambert. Health continues to be disrupted with technological innovations here in Alberta, and today we're going to take a closer look at a virtual health program created for NorQuest College students. Here to explain more are Jackie Nelson, who's the Director of Strategic Initiatives for Health and Life Sciences from NorQuest College, Raja Midha, the Executive Director for Health Innovation at Alberta Innovates, and Chris Carvello, Health City Consultant. Thank you for coming in today, you guys, and joining us.
Thanks for having us.
Absolutely. So give me a Coles Notes rundown of basically what the virtual health program is. Who wants to answer?
Jackie,
Yeah, there you go.
Super. So in October of this year, we launched a virtual health program for our NorQuest students. And what it is working with a technology platform that will provide accessible health encounters for our students, student patients. And so we're really excited about this initiative because it starts to help address some innovation within the system and starts testing some new platforms and models for care.
Mm-hmm. And so where did the need for something like this come from? Like, where were you guys seeing the gaps in healthcare that needed to be filled?
So I think that one of the things is we traditionally have seen a lot of advancements in other industries using technology, and healthcare has not advanced as much as other industries. And so NorQuest, in an effort to try to find contemporary learning environments for our students, we started doing a bit of industry trend watching and identifying sort of that what might be of the future. And then you think about how do we teach that future generation of healthcare workforce. And so what we identified was that we have this aging population and also this increased prevalence of chronic disease paired with an unsustainable financial health budget. And then on the other hand, we have emergence of new technologies as well as an increase in instant access and consumerism among patients. So when you kind of take all that into consideration, you think, well, how do we teach this next generation? How are the front line of workforce going to be able to be prepared for the what might be and what healthcare will look like in the future? So we started down a path of just looking at some different projects that we call like a living lab. So there are opportunities to test different innovations, different models, and learn from them. And so this would be our first one that really looks at the usability of a virtual platform, so delivering primary care in a different way, and looking at how that might impact access for different sort of backgrounds of patients.
Mm-hmm. And this is a big push for the future. I mean, to be able to educate these people and the students in a very efficient and effective way, that sounds like that's going to be a massive feather in your guys' cap for pushing health forward. So talk to us a little bit about some of the partners that were involved in the program.
So maybe I'll jump in and talk about why Alberta Innovates got into this and why we find this to be a really neat opportunity. So as Jackie said, there's a wave of technological innovation coming forward, and it's being adopted across all industries, including in health. And we see, as an organization, health is everybody's responsibility. And there are some things that the healthcare system proper, that most people think about in terms of hospitals and primary care, are able to do. But sometimes there's limited flexibility. I mean, our healthcare system is it's overburdened with trying to make sure that they're delivering the right care to the right patient at the right time. They're doing an amazing job. And so there isn't always room for this type of innovation to be tested and to be demonstrated. And so to be able to partner with NorQuest from a healthcare professional education training perspective and a new way to deliver care to a unique population of students, and to learn from that and sandbox that and take that and think about how we can take those learnings and apply them to other post-secondaries, apply them to primary care, think about how we can move that across the healthcare system is really, really important for us. So we're always trying to find those opportunities with partners that are not your typical healthcare partners, and to try to work very closely with them. And NorQuest has proven to be a very nice, innovative culture to be able to do that and to try to test these see how they work.
For sure. Well, and like we talked about a little bit off camera, just in regards to how NorQuest has the ability to kind of do some testing and some playing around and try different things and new things to see how they work without actually being in the field and affecting directly. You have that ability to play a little bit and get results and see what those results and see if they're successful before the implementation.
And that's the perfect thing, is you're right, you're absolutely right, Bryce. It's a test, but at the same time, we're still impacting the health of a population in a positive way.
Yes.
And so it's while it's a demo, we're still getting the impact that we're all after.
Gotcha.
And I think just to add on that, taking a look at the place that NorQuest has played and with partners like AI and Health City and some of the other groups, I think we've been able to do those exact demonstration projects a lot faster because, as you said, maybe not a traditional partner, because there's the education component and the student population. We're actually able to move a project like this that historically can take months to, from start to finish. We first started having some conversations around this, in the fall, and our first, I guess I've been a little before, but the first patient was actually seen sometime in October. So, much shorter time frame. We're able to accelerate some of these things and then use them as examples for how we can actually start to look to scale these provincially.
Gotcha. Can you tell us a little bit about some of the responses you've gotten from the students in the field that are using the program?
Great question.
Yeah, so currently we launched in middle of October, so we have 108 students enrolled, and I think we're just over 80 different patient encounters. And so we're still receiving some of the analysis back in terms of their surveys, but it's been a 5 out of 5 in terms of user rating for their experience, and lots of positive comments around, wow, how convenient. I would definitely use this again.
Yeah.
This is amazing. I can use this all hours of the night. Imagine if, I could see the benefit of having this for anyone who has a mobility issue or lives in a rural environment, or there's a transportation issue, or, right?
Yes.
There's so many different use cases of why this might be an opportunity to enhance our current system.
Absolutely. So just without getting too technical, can you tell us a little bit how the data is used and how this kind of works? Like, how does this all come together? So from a student's perspective, how are they going to go about and implement this program? Like, how do they use it?
So the students, they receive an opportunity to enroll in the platform, and then they're just sent a link from the actual virtual care provider.
Gotcha.
And then they can go on themselves. And so when NorQuest doesn't have any sort of interaction with their health data at all.
Oh, I see.
So it's just a provider to student relationship.
Yeah.
So the student goes on and accesses the primary care provider and addresses all of their concerns, whether that's on their phone, their computer, and it's via like kind of a text message type of a scenario, or it's a virtual, like a video connection. You can take pictures, that kind of a thing. So it's really user-friendly and convenient, like instant access.
Yeah, and that instant obviously increases the efficiency, increases the speed, the healthcare. The subject gets taken care of a lot faster. So that's really cool. So
The key there is the interaction, and the process for that interaction is very simple. Right?
Yeah.
It's not complex. The students can access really easily. They can get the information back from their provider really easily, and it's all handled by the service provider as well in terms of the data and the security to make sure that all of that is taken care of.
Right, that's fantastic. So that's pretty much answers a lot of the questions that I had about the program. Was there anything that you guys wanted to add about it that you want that you feel people should know about it?
I think I would just add that this is just sort of a first step into how the health ecosystem can come together. And I think that one of the remarkable findings that I've had throughout this process is how open our Edmonton health ecosystem is. And like we've been working with Edmonton Health City, Alberta Innovates, and a number of other stakeholders.
Yes.
And everyone has been so aligned in terms of vision that exploring the future and how we can collaboratively all impact how that might unfold. And so I think that we'll use some of these small projects as an opportunity to have lessons learned and inform what some of those broader next steps, scalable solutions might look like. But it's definitely an ecosystem-wide opportunity for Edmonton and Alberta to move the needle on healthcare.
It's so nice to see that collaboration, that people see a need.
Yeah.
Let's get it done. And it's nice that you were able to work with NorQuest College in that regards, where they can kind of fast track that process and really get down to the nitty gritty and get it in there.
To add a little bit to what Jackie said is if I look back 12 months ago, I don't know that we ever would have thought that we would be doing this project with NorQuest. And so even us as an entity, we're starting to open our minds around who are the players that can actually help make an impact for patients in this province.
Yeah.
And NorQuest is one of them, and there are many others out there that are not the traditional partners that we want to continue to explore and learn from and partner with as we move forward.
Fantastic.
Yeah,
So I guess another quick thing, and you kind of alluded to it, so I mean, these are the first steps to kind of get us into some newer, broader, more dynamic solutions for a lot of other problems. Where does something like this, where can you see something like this kind of leading to? Just as a, like, you know, let's look forward to Star Trek and let's see, you know, like, where does this kind of go to? What are the opportunities?
So maybe it'd be interesting for Jackie to go into a bit more detail on the living lab concept overall, but I think what we're starting to see is there's some core streams that are starting to come out. Virtual care is obviously one of them. Home health monitoring is another. So there's certain things that are occurring outside of Alberta that we maybe have fallen a bit behind on. So I think that's kind of where we're focusing, is some of these core areas where some of these larger entities that are going to be the service providers are looking at, we can help to provide a bit more evidence on de-risking when they are ready to make a decision to move into that space. So through the living lab, which and Jackie can probably go into more detail on, that's really what we're looking at doing.
Yeah, because you're kind of making the stepping stone then to speed up the process for the next thing. Because like you said, de-risking it, you're kind of getting it all done at the forefront. And now the next thing can actually build on top of this.
Absolutely.
That's really cool. So yeah, was there anything you wanted to add to that, Jackie?
Yeah, I think in terms of, like Chris mentioned, the home health monitoring aspect, we're also looking, like, our graduates, our students are going to be mostly working in community and continuing care when they enter the workforce. So some of our main intentions are to kind of arm them with the digital capacity of sort of tomorrow. How will they be able to use this technology, work with data, be that one-on-one sort of conduit between patient and technology, and help to be sort of that change enabler of system transformation? And so one of the things as we're doing is, you know, if we can sort of kind of put our flag in the sand of saying, you know, this is where our students are going to be, if we can make sure that we have the best future-ready workforce possible in that regard in terms of community, how can that impact how we take care of, how do we keep people in their homes longer? How do we sort of help to transition care outside of the hospital and into community more to help facilitate system change? And so the intent is to, you know, take care of as many problems as we can in the community and keeping them from the acute setting. But sort of transitioning from the living lab idea is when a patient becomes elderly and maybe their acuity level changes, what does that even mean for continuing care? And so NorQuest is kind of continuing to push the boundaries on that. And we're working with another health provider to look at developing a capital project that's a teaching and research continuing care center, where we'd have continuing care residents and teaching and learning embedded within the same facility. So. And then, of course, all infused with technology. So what does continuing care of the future look like? And what can we learn from that and embed into our curriculum so that we can continue to sort of help spur forward initiatives?
Right. And can we talk a little bit about some of your other partners on the software back end of things? Can we mention just some of the groups that you're working with on that?
Yeah.
Yeah, talk
Yeah,
about
so for the virtual care project, Maple has been our partner.
Right.
So they're a startup out of a small company out of Toronto.
Yeah.
They've been a great partner. I think that's one of the reasons we've been able to move so quickly, is because they've been fairly nimble and flexible in terms of our needs, but they also had a very solid technology product, and as well as a big provider network to be able to support something like this. So it's been a great example of how even some of those smaller companies that have a great idea can actually incorporate into the healthcare system.
That's fantastic. Yeah, you guys have really stretched it out. It's so nice to see this collaboration with a wide variety of groups, again, coming together, seeing a need for something, coming up with a solution and executing it, and it's super great to see that. So thank you so much, you guys, for coming in and sharing this information with us and this knowledge, and we'll be sure to try and get more of the information out there to the public and to obviously your users, because they're going to benefit the most from it, and then that just trickles down into the public and so forth. So again, thank you so much for joining us today.
Great, thank you.
Thanks for having us.
You betcha.
that's called.